everyone, and welcome to Public Health History. In 1932, a small ferry tied up at this jetty, now known locally as Patient Pier. The boat was the first of many, bringing thousands of people diagnosed with Hansen's disease, more commonly referred to as leprosy, to Nagashima Island off the coast of Okayama, in the Japanese Seto Naikai, or Inland Sea. The now broken pier is considered by many to be a symbolic marker of the separation from family, friends, workplaces and communities that most of the residents of the island would experience for the remainder of their lives. As poet Akashi Kaijin wrote later, "Forsaking the name once chosen by father, I enter this island hospital to lie beneath its tower." From here, a path led up the hill to the reception centre of Nagashima Aiseien, one of Japan's best-known isolation facilities for people with leprosy. During the admission process, patients were stripped and their clothes and prohibited possessions confiscated. They were then photographed and forced to immerse themselves in a disinfectant bath for 15 minutes. After 10 days of observation, they were released into their new community, a process that was dehumanizing and medically unnecessary. While bathing facilities had already been constructed, these proved insufficient for the growing number of patients. The new residents, initially referred to as colonists, were expected to engage in one or more of over 70 different types of work: construction of homes, clearing land, cutting roads, growing food, and undertaking other duties related to the running of the facility. In many cases, this worsened their own conditions. As numbers on the island grew, overcrowding became a major concern, leading to hunger and eventually to patient revolts. The story of Japan's treatment of those suffering from leprosy is complex and nuanced. There is both a genuine concern and commitment by health workers for patient welfare, alongside a protracted legacy of deprivation of basic human rights, discrimination and exclusion. In this video, I'm going to explore how Japan organized its response to Hansen's disease. One of the key sources is the well-researched and engaging book by Susan Burns, called Kingdom of the Sick, A History of Leprosy in Japan, as well as publications by Catherine Tanaka and others. In 2025, I visited the Kokuritsu Ryoyojo Nagashima Aiseien, or the National Sanatorium in Okayama Prefecture, Japan, where I spent several hours wandering the island and visiting the excellent museum. The museum has requested that photos of former patients not be used, so I've not included pictures of people unless they are already in the public domain. I have also used footage from the film Spring on Lepers Island, which I'll come to later. It is important to acknowledge that the name leprosy is still in widespread use, including by the WHO, but that it comes with enormous historical baggage, in terms of social prejudices and ostracism, as well as colonial discourses. In Japan, the historical term Rai, now considered discriminatory, has largely been replaced by the term Hansen's disease, recognizing the German discoverer of the bacillus. There's an ongoing push for this renaming to occur globally. Hansen's disease is caused by two types of bacteria, Mycobacterium leprae, pictured here, and Mycobacterium lepromatosis. It is transmitted through frequent exposure to droplets from an infected person's nose or mouth. This is one reason it tended to be passed down to family members. It's slow to develop, with first symptoms occurring between 1 and 20 years after exposure. Hansen's disease primarily affects the nerves, leading to a loss of sensation that makes individuals more susceptible to unnoticed injuries and infections. In some cases, this can lead to amputation of affected limbs or extremities. It can also cause damage to the eyes, and in some cases to vision loss, as well as affecting the skin and mucous membranes. In advanced cases, visible changes such as tissue loss, bone reabsorption and muscle weakness may occur, contributing to physical deterioration and disability. The bacterium was initially isolated by Gerhard Hansen in 1873, and an effective treatment, the drug Proman, first became available in the 1940s, followed shortly after by another drug, dapsone. Today, despite increasing drug resistance, Hansen's disease is considered curable using a multi-drug treatment. The earliest direct evidence of Hansen's disease dates back at least 4,000 years, with skeletal remains from India from around 2000 BCE, demonstrating physical conditions consistent with leprosy. This is supported by later textual references in Sanskrit documents. Earlier evidence from mummified remains in Egypt is less clear but may indicate physical evidence of Hansen's disease infection. In Japan, there are written accounts describing Rai from the 8th century. Texts from the late 12th and 13th centuries attribute the disease to bad karma, a result of sinful actions in a previous life. Conversely, non-sufferers, very often monks and later Christian clergy seeking God's grace, could advance their own spiritual merit scores by serving and supporting people with leprosy. The 14th century Empress Komyo is famously reported to have bathed and tended to a leper, even sucking the pus from his wounds, followed by the sudden transformation of the leper into a bodhisattva. The explanations on the causes of leprosy in the late 18th and early 19th centuries shifted to bad blood, something that could be passed from parent to child, its presence growing stronger as it was passed between generations. People were advised to choose partners carefully and investigate the family before marriage. This new conception of the cause of leprosy coexisted with that of karmic retribution, with the underlying implications that sufferers themselves were to blame for their illness. It also meant, according to some, that it was not treatable because it was divine in origin. These ideas contributed to broader social fears over the disease, promulgating the desire to socially exclude its sufferers. The idea of formalized treatment centers for leprosy patients began to emerge in the Meiji period, the late 1860s onwards, with doctors such as Goto Masafumi and his son Goto Masanao, pictured here, garnering minor celebrity status. In 1907, the Japanese government first passed a law creating 5 regional leprosaria. These were part of a global trend. In the West, the same period saw the institutionalization of mental health care, tuberculosis care, and leprosy treatment. Japan, as an emerging power and anxious to be seen among the other scientifically advanced nations, moved quickly to ensure that its own approach followed these same principles. Lepers were associated with colonies and backwardness, exactly the opposite of the image Japan sought to portray. Consequently, Japan's leprosaria were located in remote areas, symbolically and physically removed from the rest of society. By the 1920s, public anxiety about leprosy was intensifying. Newspapers, local authorities, and social reformers linked the disease with social degeneration and national weakness. Authorities increasingly removed patients, particularly beggars, from public spaces and expanded the sanatoria system. Physician Dr. Mitsuda Kensuke established Nagashima Aiseien in Okayama based on his experiences of sanatoria while travelling back from the International Conference on Leprosy in 1923. His intention in establishing new isolated sanatoria like Aiseien was to create an ideal separate world for leprosy sufferers, demonstrating Japan's advanced and progressive stance. Construction began in 1927. Over 100 buildings were built within the first few years, based on a substantial budget of 11 million yen. The 26 hectares allowed the separation of administration and medical staff from the area where patients were housed. The completion and opening of Aiseien almost coincided with the passing of the 1931 leprosy laws, which mandated the voluntary, or, when necessary, forceful removal of Hansen's disease sufferers from their communities or other healthcare centres. The inclusion of free care, regardless of means, made the prospect of moving to Nagashima Aiseien and the other sanatoria much more attractive, and many patients applied to be transferred to the facility without realising their relocation would be permanent. Those who refused, however, were often transferred by force or mounting social pressure. When a case was identified, the whole house was sprayed with disinfectant, again medically useless, but unfortunately identifying the occupants, whether they were infected or not, to their whole neighbourhood, subjecting them to public shame. This reportedly led to the suicide of an entire family of 9 in 1951. Burns reports that these activities were coupled with messages amplifying fears of the disease. For example, she writes, "In a pamphlet produced by Aiseien, leprosy sufferers who remained outside the sanatorium were described as putrid, living in darkness and foul-smelling. Readers were asked to consider whether an infected person might be working in their local sweet shop or eatery, and even now extending the hand of unseen danger toward them." One of the medical doctors who worked at Nagashima Aiseien was Ogawa Masako. Her main role appears to have been to tour the prefecture, to first diagnose and then persuade leprosy patients to enter the sanatorium, as part of the Muraiken Undo, or leprosy-free prefecture movement. The leprosy-free prefecture movement strongly encouraged local authorities, health workers, religious organizations and schools to report anyone showing symptoms of leprosy to the police. Neighbors were also offered incentives to report those suspected of being hidden sufferers. By the 1930s, National Leprosy Prevention Days were being held. As Japan headed towards militarism, leprosy was reframed as a way to promote national unity, as part of the Muraiken Undo, or leprosy-free prefecture movement. This movement was contemporaneous with rising nationalism in the years leading up to World War II. Only healthy individuals, it was thought, could contribute to their nation and serve the imperial family of Japan. Having leprosy was branded as a shame for the family and the nation, with confinement in a sanatorium the only recourse left to infected individuals. This movement propagated mistaken beliefs and cemented the prejudice that leprosy was a deadly, fearful contagion. Burns writes that there was an explosion of public discourse as Japanese citizens were called upon to help eradicate leprosy and support its victims. Ogawa Masako documented her experiences in a book published in 1938, Kojima no Haru, or Spring on a Small Island. This was later adapted into a film titled in English Spring on Leper's Island, starring the popular Japanese actress Natsugawa Shizue, who played Ogawa. The movie focuses on the experiences of a leprosy sufferer and his family, who have been ostracized by their community. Ogawa eventually persuades him to join a sanatorium, and he receives a grateful farewell from the community that had, until this time, been bullying him and his son. The film achieved widespread acclaim across Japan, and reinforced the social forces and attitudes around leprosy. The initial plan to house 400 residents at Nagashima Aiseien was met within a few months. However, Aiseien director Mitsuda refused to cap admissions. After receiving additional refugees from the typhoon-damaged facility at Sotojima, the population soon topped 1,000, and dissatisfaction at the overcrowding and deterioration in food and care reached a boiling point, and patients began actively trying to escape. On August 13, 1936, patients gathered near the Megumi no Kane, or Bell of Grace, to call a general strike in protest against living conditions, labour practices and disciplinary measures. This action marked the beginning of organised resistance, which included hunger strikes and other forms of collective protest. However, ultimately, the patients themselves were held responsible for the demonstrations and riots. Discussions began on the construction of a prison, known by the Orwellian label of Tokubetsu Byoshitsu, or Special Hospital Ward. The prison on Nagashima Aiseien comprised 8 isolation cells in 2 types: disciplinary cells for serious cases and calming cells for shorter stays of 2 to 3 days. Prison was mandated for those who rebelled against the island authorities or who tried to escape from the facility. Prisoners were held without trial or right of appeal and were reportedly denied adequate food and medical treatment. On Nagashima Aiseien, shouting and screaming could often be heard coming from inside the prison. A recent article in the Asahi Shimbun reported 150 people were interned between the years 1946 and 1950 alone. Remarkably, after it was closed in 1953, it was not demolished but covered with earth and sand, allowing researchers to later revisit the facility. Burns argues that the construction of the special hospital wards at Aiseien and other sanatoria locations represents an important transition of attitudes towards leprosy sufferers, from enlightened colonizers willing to make a self-sacrifice for the good of Japan to potentially dangerous others who had to be controlled and contained, a transition that had taken just a decade. Patients were referred to by their admission numbers rather than their names. The shame of relatives back home meant that even their remains were not returned after death, with many interned in the island mausoleum. Children diagnosed with Hansen's disease were often institutionalized in sanatoria for life, leaving their parents and siblings behind to live in collective dorms. While junior high education was provided, only Nagashima Aiseien offered high school education, where teachers wore protective gear and were sanitized after class. In a heartbreaking poem, one sixth-grade child wrote of the experience of separation. "When it rained, my mother always roasted beans for me. I hear the sound of the rain, like beans roasting, and realize that my mother is no longer by my side." Educational quality was poor, and nearly 60% of students reported dissatisfaction, citing a lack of empathy, knowledge and fairness among staff. Uninfected children of leprosy patients, though medically cleared, faced intense stigma when attending local schools. In one 1954 case, 4 children were forced to leave school after widespread parental protests and bullying. Even after graduating, many of those who were uninfected faced severe employment discrimination due to the school's association with leprosy, often concealing their past. Graduation albums omitted names and photos. Forced confinement of Hansen's disease patients to the sanatoria became ever more coercive during the war years. Food shortages also led to increased deaths among the patients, with mortality rates growing from 5% before the war to 22% in 1945. And more than 400 patients reportedly attempted to escape from the island between 1942 and 1945. This was made more difficult by the deliberate introduction of an island currency to replace regular money, meaning that once reaching the mainland, any escapees would have few resources to get back to their hometowns. Multiple attempts to include leprosy in Japan's eugenics laws failed, and patient consent remained the formal policy. Yet sterilization was considered a necessity by Mitsuda and others, and permission to marry or live with other patients on the island was conditional on agreement to sterilization. However, many patients also described their feelings of relief from the fear that they might pass the disease on to their children. While the issue of sterilizations is clearly nuanced, it is evident that island authorities promoted sterilization to the point of coerciveness. Another serious human rights concern involved the conduct of autopsies, with almost all patients, thousands of bodies, subjected to this procedure after death. However, in many cases, consent appears to have been provided shortly before, or in at least 39 cases, even after death, suggesting that doctors falsified the consent process or failed to do it at all. In an article published in the Asahi newspaper in 2023, Uchida Hirofumi, director of the National Hansen's Disease Museum in Western Tokyo, is quoted as saying that, in sanatorium autopsies, every organ in the body was removed, even those unrelated to pathology, and the handling of the removed organs was sloppy, and that numerous residents were treated as research material, with no regard for their dignity. Skeletons of former patients in nearby Kyushu also turned up in medical schools, prompting a further outcry. Post-war activism initially centered around the need for improved conditions on the island and access to the drug Proman. Yet, even though effective treatment was now available, the government resisted calls to retract the isolation laws, even though some people were eventually released. Many of those in the now aging population of former patients, fearing discrimination outside of the community, preferred to remain on the island. Residents developed groups as a means of promoting community life. Traditional religious and cultural events like obon dances and sumo tournaments were held. Art and pottery groups produced high-quality artifacts and paintings. And in 1953, a band was formed, the Bluebird Orchestra for the Blind. The residents also collected weather observations, sending them to the Japan Meteorological Agency up until 1979. After World War II, when residents began to receive a regular disability stipend, pachinko and karaoke also turned up on the island. However, literature became one of the main forms of expression, both cultural and political, later known to become under its own genre as leprosy literature. Traditional Japanese poetry forms such as tanka and haiku documented the pain and suffering experienced by the residents, both from the physical experience of their disease and the lost relationships and experiences of life. Some authors became bestsellers throughout Japan, with the writer Hojo Tamio and poet Kaijin Akashi, whom we met at the beginning of this episode, achieving widespread fame. Akashi lived at Nagashima Aiseien from 1926 until he passed away in 1939. His Hakubyo anthology, which was written after he had lost his eyesight, sold more than 250,000 copies across Japan. One of his most widely recognized poems from the anthology roughly translates as, "Leprosy fell upon me like a divine scourge. As my afflictions mounted one after the other, I sobbed, I cried out, I moaned in agony, even as I groped through the dark days of my illness for a ray of light to guide me. But like those luminescent fish dwelling in the sunless depths of the sea, I would have no light until I lit up from within." Leprosy poetry, and later Hansen's disease poetry, was encouraged by island authorities as a means of promoting the National Sanatoria program, and consequently poems written by former patients have been dismissed as propaganda. However, many of the published poems also reflect deep satisfaction with their experiences in the sanatoria, including the experience of physical isolation and separation from loved ones, as well as the lack of freedoms and autonomy. Tanaka argues that the poems also represent a kind of translation, whereby patients were renegotiating their experience of the disease, and that they sought out opportunities for happiness. Freedom from social stigma and the efforts of medical staff to provide care allowed respite from the anxiety and the offer of hope. Following the introduction of Promin in the 1940s and the introduction of multi-drug therapy over subsequent decades, it was no longer necessary to enforce quarantine. The 1953 revision of the leprosy prevention law required the continued confinement of patients who posed any risk of infection, and discontent again rose. Patient activists argued that the new law condemned them to a continued existence as outcasts. While some patients who had been successfully treated were released, those who had been institutionalized earlier or lacked the skills to be able to return to active employment were less likely to take up this option. This led to allegations that those who chose to remain were idle, incensing patients who had suffered through the war and from years of social exclusion. Reintegration required a different kind of healing than simply treatment of the disease itself. On May 11, 2001, the Kumamoto District Court on the southern Japanese island of Kyushu found in favour of a group of Hansen's disease survivors and their families, who had brought a case against the government regarding their treatment and the violation of their human rights over previous decades. 2 weeks later, on May 25th, then Japanese Prime Minister Junichiro Koizumi announced that the government would not appeal the decision of the court, opening the way to a genuine process of addressing the systematic injustices, discrimination, as well as exclusion that many in the community had faced, despite an effective cure for the disease being found more than 50 years before. Koizumi acknowledged that former policies adopted by Japan in the admitting of patients of Hansen's disease to the facilities restricted and limited the human rights of many patients, in addition to the severe prejudice of society in general and the discrimination that has existed. The government has reflected on the pain and the suffering experienced by patients and former patients alike, and would like to offer an honest apology to those people and condolences to those who have already passed away after much suffering and resentment. In doing so, Koizumi opened the way to compensation for many of the victims of government policies over previous decades. Even long after the official repeal of Japan's segregation policy in 1996 and the Kumamoto Court's ruling in 2001, the consequences continue. The Mainichi newspaper reports that between 2009 and 2018, 129 former patients re-entered sanatoriums, unable to cope with life in a society that still views them with suspicion. The fear of social exclusion and the absence of an accepting community is coupled with the lack of the necessary medical skills in mainstream health services to treat the after effects of leprosy. These factors have made returning to sanatoria such as Aiseien attractive. The history of Japan's Hansen's disease sanatoria raises enduring questions for public health ethics. State efforts to control infection quickly evolved into a system of indefinite isolation, coercive sterilization, and routine violations of individual rights. This is despite the disease affecting far fewer people than tuberculosis at that time, and long after effective treatments became available. Yet these were not only sites of control. Patients formed vibrant, self-contained communities, working, creating, organizing, and resisting. Patients developed and demonstrated autonomy even when faced with the denial of their choices and rights. Cultural expression, from poetry to protest, helped preserve dignity in the face of exclusion. Although many patients actively supported policies of isolation, sterilization, and compliance, this does not absolve authorities of the responsibility for coercive and unethical policies and practices that fueled public fears and denied people the right to live their most fulfilling lives, at minimal risk to the public. The sanatoria stand as a warning that even in well-intentioned public health policy, fear and prejudice can erode ethical boundaries. Fear and prejudice were not just the outcome of government policies, but were instrumental in their enforcement. Today, as the community ages, its legacy endures through museums like Nagashima Aiseien, reminding us that public health must always balance collective well-being with human rights, dignity, and consent. As one of the photo captions in the museum points out, for those with nowhere to go, sanatoriums were both places of isolation and places of life. Many of the things that happen in society also happen in sanatoriums, and even in the midst of gross violations of human rights, there was joy, fun, anger, and sadness.